Dignity Health in Arizona recently launched their first research study in North America in which genetic testing is used to identify men and women at risk of developing heart disease based on the makeup of their DNA. And joining me to explain more about this is Dr. Robert Roberts. And we're talking, doctor, about something that is so important to a lot of people, not just those who might have heart problems, but those who don't have it. And we've been seeing younger people, we've been seeing healthy people pass away from having heart attacks or having heart disease, and we're kind of like going, what's going on? That's very interesting. This is one way that we can find out what is actually going on with them, isn't it?
That is correct. We've known that about 50% of risk for heart disease is acquired factors such as smoking, high blood pressure, and we have known that since the 60s. However, we've also known from epidemiological studies that about 50% of your risk is due to your genes. Unfortunately, the technology did not exist to identify those genes until 2005, and in 2007, my lab identified the first gene. Then we collaborated across the world and identified over 200 genes that predispose to heart disease. What is important about that is heart disease starts out early in life. We know that from the Vietnamese soldiers who died during their average age was 21, they already had the beginning of some heart disease. Wow. Now, the second point then is genetics is determined at conception before you're born. Because it's in your DNA, it doesn't change in your lifetime. So for the first time now, we could test someone in their 20s or 30s. Secondly, we've already shown that we can decrease that genetic risk by 50%. That's already been published and documented. So the option now we have is that we can test someone in their 20s or 30s. If they're at high risk, we can treat them. We've always proven we can. This is why many of us feel that this should be the last century for heart disease.
Yeah.
We now have comprehensive, what we call primary prevention, before that disease developed to give you heart attacks, etc.
I love this because what we've known in the past about how to prevent heart disease, exercising, dieting, watching your stress level and everything like that. And everybody does that, but then they're still going, well, why am I still having these heart problems? And this is the reason right here. So as you said, you'll be able to check their DNA and help them move forward to take care of this.
Yes, and it's a simple blood test that we can take. It is free, and the first consultation follow-up is free. And if they're at high risk, we recommend in that consultation what they can do to decrease it. And we already have proof, as I indicated, that we can do that.
Yeah, and what Dignity Health really wants people to do is really to come do this and hopefully make it a regular part of checkups, make it a regular part of people getting seen, because again, it helps us be able to, as you said, stop the heart attack, stop the heart disease if we can start it early in this kind of detection.
And I think, as you pointed out earlier, it's a common disease. It's the most common cause of death in the world. 1/3 of all the deaths in the world today are due to heart disease. As an American, if you live a normal lifespan, you have about a 50% chance that you'll have at least one cardiac event. So my point I'm making to you is that this should be a big surge now that we have both the genetic and the acquired, and we have proven it will work if we lower it. So we, I think, at St. Joe's and Dignity, because you can get this done either at of the 3 hospitals, we feel this is a very important study. We hope it will set the standard and be incorporated into clinical practice in the near future.
I like it. And I really have to say this, and I mean, you correct me or not, but I feel like women should get this because we see that women do pass away more from heart disease, not knowing what they're passing away from. Because they might not think it's genetic. They just think it's because of stress and everything like that. Is that something also too you guys think that should be seen and more women should be checking this? And of course, minorities?
Absolutely. As you know, that the real reason in large part why women are not checked as much as they should, because of until they reach menopause, they are relatively protected. And that protection is often in the minds of the physician. You're a woman, don't need to do it. We should turn that around. Women, because they have the same incidence of heart disease as men, except the peak for men is 58, the peak for women is 68, 10 years later. We have the opportunity in women, even more so than men, start it in their 30s or 40s, prevent it. Right now it's happening and then we're treating it.
Yeah, that is so amazing. Doctor, this is so incredible what you have discovered and are doing, and so important. I know it's continue on. The most thing we could say is please check with your doctors. This is a voluntary thing to do, but you do it, it's going to save your life and possibly even your other family members' lives too.
Yes, in fact, people with family history, as you referred to, you'll see someone who is really as skinny as they can be. They're following all the things, they're athletic, and of course they have a high number of risk variants they've inherited, and that we can treat them, and we certainly encourage them to bring the family in to be treated as well.
Doctor, thank you very much for bringing this information to us. We appreciate you coming in and talking with us. So, and you want to find out more information, you can go over to our website, aztv.com, and you can connect with Dignity Health and see what they're doing in the community for all our health issues. So check it out. Thank you, Doctor.